On October 26, 2011, a newly published study in the British Medical Journal by Dr. Lidegaard and his research team located in Denmark demonstrates a significantly higher risk of venous thrombotic event, also known as VTE, for users of the oral contraceptives Yaz and Yasmin. This study used the same registry-based group of all Danish women ages 15 to 49 years with no history of VTE and who were not pregnant. This study followed the women from 2001 to 2009, 4 years longer than the previous study that this very group conducted that also demonstrated a similar increased risk of VTE to users of these drugs. Dr. Lidegaard and his colleagues found that compared to women not using hormonal contraceptives, users of third and fourth generation oral contraceptives like Yaz and Yasmin encountered a 6-fold increase in risk for venous thrombotic event and pulmonary embolism. Interestingly enough, Bayer funded this study, and yet Bayer still denies the risk that their drugs pose. In their own words, they are still evaluating the results of this study, but their other research indicates that their drugs are just as safe as all other products on the market. However, this new Lidegaard study certainly suggests otherwise. And today, October 27, 2011, the news for Bayer has gotten much worse. The United States Food and Drug Administration has just announced the results of its study entitled Combined Hormonal Contraceptives and the Risk of Thromboembolism and Other Cardiovascular Events. The purpose of this study was to assess the risk of VTE and cardiovascular injuries posed by several of the most recently approved oral contraceptive products. These products have a significant number of users that allowed researchers to evaluate the risks compared to those associated with older, more frequently prescribed contraceptives. This FDA-funded study was conducted at 2 HMO sites and 2 state Medicaid programs, each associated with an educational institution. The researchers conducting this study had access to data from a large group of young, reproductive age women. More than 800,000 women made up the group of study subjects. The study was designed as a retrospective cohort study of women ages 10 to 55 who were current users of third or fourth generation oral contraceptives. These contraceptives included Yaz and Yasmin. This study found that young women who use Yaz and Yasmin during the first several months of use are exposed to 2 to 3-fold greater increased risk for VTE than women who take older oral contraceptives that are just as effective in preventing pregnancy. Therefore, this study, along with the others, prove that Yaz and Yasmin have been exposing women to a significantly higher risk without providing any additional benefit over the other, older contraceptives. Unfortunately, Bayer Pharmaceuticals still refuses to acknowledge the dangers that their drugs have created. They continue to stick their head in the sand and claim that Yaz and Yasmin are as safe as other products on the market. But now, with this new study, that suggestion no longer holds water. The big question now is, how long has Bayer known about these risks, and what could have been done to warn doctors and patients before they encountered the dangers posed by these drugs? Unfortunately for some women, this information and the answers to these questions will have come much too late. We do know that earlier studies put Bayer on notice in 2009 about the increased risk for VTE. But now, nearly 2 years later, after hundreds of thousands of new prescriptions and millions of contraceptive pills popped, Yaz and Yasmin remain on the market.